Hello everyone, my name is Jen Nolan and I'm the Policy and Programs Manager at Musculoskeletal Australia, and I'd like to warmly welcome you to our webinar this evening on the topic of musculoskeletal health and your mental health. We are very grateful to AbbVie Pty Limited for their sponsorship of this evening's webinar. In line with Musculoskeletal Australia's focus on empowering consumers through education and support services, we are again offering a series of webinars for a consumer audience during 2020. As you can see from the list of webinars on your screens now, they cover a range of relevant topics. If you wish to register for other webinars in the series and you haven't already done so, please go to our website at www.msk.org.au. Whether registering for the webinars or not, can I urge you all to have a thorough look through our website, where you'll find an extensive range of information, films, videos, apart from our other initiatives and services such as our peer support groups, our MSK Kids program, our MSK helpline, and our Active Neighbourhoods for Older Australians project, amongst other things. We also have our regular e-newsletter to which you can subscribe. Our presenter for this evening is Dr. Jacqui Stanford. Jacqui is currently a Director and Principal Psychologist of Empower Rehab, who specialise in providing interdisciplinary pain management, as well as working with clients presenting with a range of psychological presentations. Jacqui provides training and supervision to health professionals and return to work professionals about the management of clients with persistent pain to help facilitate recovery and optimal function. She is a psychology and pain management advisor and consultant to WorkSafe Victoria. She is a member of the Australian Psychological Society and the Health College, the International Association for the Study of Pain, and the Australian Pain Society. Jacqui was the Australian Psychological Society representative at the National Pain Summit. Without further ado, I'll hand proceedings over to Jacqui. Thanks very much, Jacqui.
Thanks, Jen. Thanks for the opportunity. And one of the things I really enjoy about talking about a topic like this is I think it's really important we look at how our physical health and our mental health are related. So tonight what I'm going to do is look at how different musculoskeletal conditions can impact our mental health and hopefully give you some strategies that you can take away that can enhance what you're able to do going forward. Now, for each of you, you are going to have different physical health conditions, and you're going to be an expert in some of what's going on there, and you'll have doctors and a team of people that can help you in that space. What I really want to focus on is some of the impacts that I see, regardless of what condition you have, that impacts how your mental health works, how your quality of life is impacted. So for each of you, my guess is there's an element where your health is impacting your ability to do different activities. This may be related to what you're able to do within the home, your domestic activities. It might relate to your social and leisure activities, your ability to work, your vocation, volunteering, your independence, and some of those things. For a lot of you, there will be an element where there will be pain as part of your condition that you're experiencing, and this pain is likely to fluctuate at different times. It's not constant. So there'll be times where you have lower levels of pain and you think, yeah, I can get out and do something, I can manage this better. And then other days where that is harder. So those fluctuations and variability in your condition make it harder. It makes it harder to plan. It can also mean that it impacts on how your emotions respond in relation to that. For many of you, you'll be on medication. Medication that may be working really well for you, medication that may have side effects, medication that you wonder if it helps at all. So there's a different element there, because what that means is there's going to be lots of medical appointments that you have. Your time can often be impacted by your health in all those different areas. I remember a client years ago saying to me, I feel like my health has become my full-time job. I just want to be able to live my life. And that's the challenge that many people with chronic health conditions have, is the appointments, the medication, the symptoms. They are in the driver's seat, or can try and be in the driver's seat of your life. And so what I hope to do is give you some things that can help within the challenges that you have, how you can have better quality of life and improve how you're coping with things. Now, of course, whatever your condition is, there's always a requirement for adjustment and change. And I think that's really apparent when you look at what's happening in our society at the moment. I think when we look at what's happening with COVID-19, there's so much adjustment and change in addition to whatever adjustment and change your health condition is leading. Just because we have a pandemic across the world at the moment doesn't mean your health condition decides to stabilise and settle and be easy for you. It'd be nice if it worked that way. For many of you, there might be significant changes you're dealing with on your health, in addition to dealing with potentially social isolation if you live alone, difficulty using the strategies that you've used before to manage things. And so there's a constant need to be able to adjust and change to what's going on with your health, as well as what's going on in the world around you, in the relationships around you, in the other things that are going on in your life. And all these things end up impacting all of our mood and mental health. And we know that's an interaction. It's not just because you have pain and struggle doing things that you get frustrated. We also know that what's happening to our stress, the chemicals that our body releases when we stress also feed in and can make our pain worse, which can then make it harder to manage things. So it's always important to be looking at what's happening with our physical health and making sure we've got good support in that space, but also what's happening in our mental health. One of the things that I think is interesting is to think around what actually is mental health. I think in our society, when we talk about mental health, we often talk about mental poor health. We talk about mental illness and those things. What I think is important to think about is mental health is a continuum. Now, it's not a single line. There's not just one line of what's happening in our mental health. But what's important about thinking in the mental health space is there are days where we can feel like we're moving forward, we're feeling more positive, and then times where we feel like we're going backwards. And sometimes, unfortunately, that can all happen in the same day, within an hour, depending on what's going on. And so when we're looking at what we want to do to manage and enhance our mental health, sometimes it's really important to acknowledge where we're at the moment and look at what we can do to take one step forward. So for some of you at the moment, you might feel like you're in a -8. You're in a really tough position. When we feel like when we're in a -8 that we're aiming for a +10, it just feels insurmountable, the challenges. It can feel overwhelming. So what's more important in those moments is to go, you know what, what's the next step that I can take? What's the thing that I can do that might be able to move me forward one step? And when we can take it one step at a time, the demands don't feel as daunting and it's more achievable. For others of you, you might go, you know what, I'm in a good place at the moment. Fantastic. For those of you who you feel like mentally and emotionally you're in a good place, it's then looking at what am I doing that's allowing that to happen so that I can be learning what's my toolbox, what are the strategies that are helping this, so that if and when there's a time where there are more challenges, I can more consciously, more intentionally use those strategies. What can I do to adjust it? So again, when we're looking at what's happening in our society around COVID, for some of you, what's helped your mental health would be a support group, or you've gone and done something with a group of other people. And that may have worked well for you for weeks, months, years. One of the challenges as a society that we're finding is when some of those resources are taken away from us, there can be a vacuum. And so it can then be important to go, what can I do differently that can meet that need? Now, I don't know about you. For me, I've had more Zoom, house party, Skype conversations than I've had in my life, probably in the last couple of months. And while it's not the same as face-to-face, it can allow some connection. And so it's looking at what is it that we're needing and what is the best way that we can get that met in our current circumstances. One of the things that I'm really aware of is that what's going on in our society and now around COVID-19, we can all say we're in the same situation. On a world scale, kind of, but not really. For each of us, the unique situations in our own health, our living situation, our financial circumstances, whether we're an introvert and are glad not to have to go out of the house, whether we are craving people, makes each of us going through a unique situation. What that means is, often with our emotions, it's a term I call the emotional fruit salad. Our mental health and our emotions are not singular. We don't feel just happy. there's often a mix of different things. So we can be concerned and hopeful at the same time. We can also have about 10 at the same time. So what that means is it's important to acknowledge that in all situations, we're in an individual circumstance and need to look at it, what it is we can do. Some of the common challenges that I find from my work with clients who have different musculoskeletal conditions and different chronic health conditions is there's different emotional and mental health challenges. Some people say, yeah, I feel sad, down and flat more than I used to. I don't feel depressed, it's just there's less joy, there's less spark, things feel heavier. For others of you, you might be feeling hopeless. You feel like it's never going to get better, it's only going to go downhill. And so when you look to the future, it looks a bit grey and grim. For others of you, you might say, yep, I'm depressed. This has been going on for a long time, these feelings, and that's the challenge that I'm finding at the moment. We know with people with osteoarthritis, about 20% of people, there's a significant percent of people that have significant rates of depression. There's a significant percentage that have high rates of distress. Now, I find statistics like that interesting because that's both important and not important. What's actually the most important is how are you going? What's happening to your emotions? Because even if it was only 1% and that included you, that is something that can be helped and something needs to be done about. If it's 90% of people, it still means it's impacting you and there's things that you can do about it. Other emotional challenges that people experience might be worry. Worry about the future, worry what's going to happen regarding your health, your independence, what different medical options there are for you. Other people will say, I don't feel worried, I'm concerned. And one of the things I love about emotions is while some of you might go, worry, concern, aren't they the same? Someone else will go, nope, they feel different to me. Same with stress, same with anxiety. So emotions are complicated. We can have lots of different emotions at the same time, and what each of us experience is going to be different. One of the things that I find with chronic health conditions that gets significantly under-acknowledged is grief. In our society, in Australian culture, grief is normally linked to bereavement when there's a death of someone. And even then, we have rules or expectations around how strong that grief is allowed to be, how much it can impact us, and how long it should last. For many of you who have lost someone in your life, you might have heard statements like, time heals all wounds. It gets easier with time. The problem is that's not how grief works necessarily. If you look at the first green circle, the green circle represents you. When you have a chronic health condition, there is this big blue hole of things that's lost. It might be your independence, it might be pain-freeness, it might be quality of sleep, it might be ability to do the gardening, it might be different, it might be the fact that your time is not your own, you're now having medical appointments. There's a whole lot of losses. Grief is actually the emotional response we have to loss. When we look at grief as though it should get better with time, aren't you used to this now, does it get easier? It almost implies that those losses, those things that you used to be able to do no longer matter so much. So it's like we move to the second green circle. There's you. Those things, aren't you used to that by now? Should be fine. What that does is, unfortunately, it invalidates the losses, the emotions, the struggles that you're experiencing. And when we invalidate emotions, when we don't acknowledge them, they often get louder. What's actually more helpful to do is to move to the third circle. The third circle represents that the grief, the loss, is exactly the same in circle 1 and circle 3. That ability to do things the way you want to, some of the dreams or hopes that you had for the future that have now been lost, they might still be there. What we want to do as much as is possible is to expand our lives around those gaps. It may not look the same as the dream, but finding things that can still meet some of your needs is really important for protective parts of our mental health. We need to look at the emotions that are going on for each and every one of us in any struggle and what can we practically do to move forward to give ourselves the best chance of good quality of life. As I was saying before, everyone's unique. If we lined up 50 people with osteoarthritis, each person with osteoarthritis will have a different set of circumstances that's impacting them in their way. Every condition, say the same thing. We could line up 100 people with fibromyalgia. There might be threads that are the same. There might be some, yeah, me too. And sometimes then support groups can be really useful. It can help us connect with someone else who has some of those same shared experiences and help us not feel alone. One of the challenges is, though, where we don't feel like someone understands, where they don't understand the experiences of our own situation, can make us feel more alone and more lonely. Depression, even in mental health, it does not look the same between two different people. What we need to do is acknowledge we are unique, we're in our own circumstances, we need to look at what we can do going forward. So that might mean for you, as I said before, you've been going along okay. You had these strategies, you felt like you're on top of things. Circumstances have changed, potentially due to COVID, and all of a sudden you feel destabilised. What's interesting is because at the moment we're in a pandemic, everyone has some acknowledgement around that. I don't know about you, but when I talk to any friends, I think every conversation ends up with it coming in at least once, twice, 20 times, whether it's statistics or freedoms or different factors that are going on. The problem is when that stressor, that significant change in your life is not a universal experience, people don't check in and ask about it. So for some of you, you might have your own physical health conditions that you're struggling with at the same time as you have a child who's having significant issues in their own relationships. Those extra challenges, and it might mean you're required to now help out with their kids. Or it might be that you have a parent who's got their health challenges and now you need to add in helping them out in addition to looking after yourself. When you have your own challenges, there is often not the same understanding from other people because they may not even know those things are happening. So what's important is for ourselves to be able to go, you know what, my situation is unique. I need to develop flexibility that can adjust to what's going on in my world. I might have goals and ambitions that were great 6 months ago, but right now, they're not realistic. I may not need to throw them out. I can put them up on a shelf and come back to them later. But I might now need a new plan, some new goals that I can work on in the current situation that's going on for you, whether that's in 2020, in another 5 years' time. What can I do to be flexible to help me? What I want to do is look at some specific strategies that you can use that might be able to help you manage your condition, manage your mental health more effectively. Some of you will have heard the term cognitive behaviour therapy. It's an evidence-based treatment approach that we use as psychologists. Basically, what it does is it looks at the way our thoughts, feelings, and behaviour feed into each other. So say, for example, right now, if someone knocked on your door and brought in this massive basket of chocolate, each of you will have an emotional response to that. Some of you might feel utterly delighted. Your thoughts are, I love chocolate, I'm so excited. Your behaviour might be grab it, big smile, and go and eat it. For others of you, you might be confused and baffled, going, why are they giving me chocolate? And your behaviour might be slightly stepping back and going, okay, thanks, and it goes into the cupboard. For others of you might go, that's weird, random, not that interested, I don't even really like chocolate. And then you might be looking at who you can pass the chocolate on to. So basically, cognitive behaviour therapy is looking at how these three things feed into each other. And more importantly, what we can do to change them to make them more adaptive. How do we change our thinking? How can we change our feelings? How can we change our behaviour in order to live the life that we want to be able to live? So, in terms of our thoughts, there are 5 common thoughts that significantly impact our mental health. The first one is the word should. Have a think about it for a minute. What are some of the things that you have said to yourself, I should do? I should go for a walk. I should tidy up. I should call that person. I should eat more vegetables. I should go to bed earlier. We often create lots of rules and shoulds and expectations of ourselves of what we should be doing in a particular situation. The challenge is it doesn't actually change our behaviour. What it leads to is we end up feeling guilty and frustrated and angry. What's more helpful is to change those shoulds into I'd prefer, I'd like. I'd like to go for a walk because I'm going to feel better afterwards. I would like to tidy up because I like having a tidy house. Or we might go, I would like to go for a walk. And then we realise, no, I don't. I just feel like I should. Okay, let's not go then. Or work out why and what we're doing. The second word is similar. It's the have to. Now, I don't believe there's anything we have to do apart from be born, which we've all done, and die, hopefully for many of us a long time in the future. Yet for many of us, there's so many things that we feel like we have to do. Have to take my medication, have to go to the appointment, have to do this, have to do that. And it ends up with this feeling of pressure that creates anxiety. We end up feeling like our health condition is in the driver's seat of our life, or our pain is in the driver's seat of our life, or expectations and obligations are in the driver's seat. When you can change have to into I choose, all of a sudden you're in the driver's seat. Easier said than done. When we choose to be in the driver's seat though, we need to consider all the consequences that come from the choices we make. So if I choose to eat pizza 3 meals a day for the next 6 months because I like it, that's one consequence, yum. Unfortunately, there's another lot of consequences that are going to come where apparently that's not good for my health. So when we're making the choices, we need to weigh them up and go, you know what? Based on the consequences, I'm choosing to take this medication because it gives me the best opportunity for the quality of life that I have at the moment. I choose to go for a walk even though I don't feel like it because I know exercise is good for me and the long-term benefits of that are important. When we start focusing on the consequences and the why we're doing things, we're tapping into our values and the important parts of our motivation. We may not feel like it still, but we're tapping into why we're doing it. The third word is the word can't. What the word can't does is it makes us stuck. It stops us problem solving. Now, there are some can'ts. I can't fly. If I jump off the roof of my house right now, even if you give me $1 million, I'm going to go splat. I can't fly. But often we use that word when what we really mean is it's really hard. It's really difficult. It's not worth it. And so it can be more helpful to say to ourselves, you know what? I'm finding it hard to do the supermarket shopping. I'm finding it hard to manage my health at the moment. Because saying hard actually validates the difficulties, but also allows a window of possibility that maybe I can, maybe there's a way through, maybe I can problem solve and make this a little bit better. For many of us, when we're in that can't stage, when we have lots of can'ts, we often need someone else's help to help us get through that. But we don't need someone who just goes, don't worry, you can, you'll be fine. Because as all of us know, when someone says that, it does not make life any easier. The fourth word is actually a punctuation. It's the question mark. Any question we ask. Most people that I've met with chronic health conditions will say things like, what's the future going to hold? Am I going to get worse? Am I going to get better? Will I be able to stay independent? Is it going to be like this forever? What's going to happen next? What should I do? We have all these questions that go through our mind. And what questions do is they create uncertainty and lead to anxiety. Now, we don't ask questions if we already know the answer. I do not ask myself in the morning if I like coffee. Because guess what? By the time I've woken up, I'm probably standing at the coffee machine. So if our brain is asking a question, it's because we don't know. And it's really important to actually acknowledge that and say, you know what? I don't know if I'm going to get better or worse going forward. What I do know is I'm going to focus on getting the best treatment that I can. I'm going to focus on using the strategies and controlling the things that I can control. Now, that doesn't get rid of all uncertainty, but allows us to focus on the things we can control rather than potentially getting us overwhelmed. The final thought is the wishful thinking. Wishful thinking, hopes, dreams are really important. It gives us something to look forward to. It helps us focus on the future. The problem is, though, if we wish in of itself, it doesn't change anything. If I decide I want to be a millionaire, so I wish I was a millionaire, and I'm going to spend the next 3 months sitting here. I wish I was a millionaire. I wish I was a millionaire. I wish I was a millionaire. As you all know, it's not going to change my financial situation. Actually, might make it worse because I may not be employed anymore. But it's going to make my mood worse because what I'm accidentally doing is focusing on the struggle of where I'm at compared to where I want to be. That gap is what hurts. Now, I've just said it's okay to have wishful thinking. It's okay to look at where we want to be. It's okay to acknowledge that gap. What we need to do, though, is also bring in acceptance and or action. So that might mean I need to accept at the moment my health is not good, I have a lot of pain and I'm struggling. I don't like it and I accept it. Acceptance is different to being resigned to something. It's not about being trapped or stuck. It's acknowledging it is what it is. And then we can actually then bring in action. I'm now going to focus on what I can do to move forward so that in 1 month, 3 months, hopefully I'm not in the same situation where that's possible. So there's 5 different words that I find underpin about 95% of the struggles that we have emotionally. Now, if you think back to that triangle, I said thoughts, feelings, or emotions and behaviour all feed into each other. And the most effective way to improve our mental health is to actually address all 3 at the same time. So in terms of our emotions, the way I think about emotions is, for any of you who have been around a 3-year-old who's emotional or wants your attention, if we ignore them, they get louder. And if we keep ignoring a 3-year-old, they get physical. They'll climb on us, they tug us, they poke us to get our attention. For all of us, whether we are 3, 20, 50, 92, our emotions work in the same way. When we ignore our emotions, push them away, try and just get on with things, it can work for a bit. At some point, for many of us, it stops working. What's way more powerful is to actually validate the feelings, acknowledge them, not necessarily jump into the pool with them and feel like we're overwhelmed, but it's acknowledging, I'm finding this hard. I'm feeling overwhelmed at the moment. I miss being able to run. And that's okay. Because what we tend to do is we tend to end up minimizing it. We'll often go, well, others have it worse. I should be thankful that I can do this. Everyone goes through this at the same time. That generally, if it makes us feel better, is for a few seconds. What's more important is to actually acknowledge those emotions and allow ourselves to process them. One of the things that can be really important, and there's a lot of things coming out at the moment around self-compassion. Because if I had a friend going through a hard time right now, what is the most useful thing I could say to her is, I'm really sorry this is so tough for you. I wish there was more I could do to help. Because when we actually show compassion, it shows a connection with that person. And that's often when our emotions are upset, what we're needing. If there was a simple fix, we would have fixed it ourselves. If it was as simple as not worrying or being more thankful, we would have done that. The challenges that we face as humans aren't that simple. And what's more helpful is to have compassion. So for each of you, I'd encourage you, how do you be kinder to yourself? How do you be more compassionate and validate your emotions so they feel heard? We need to do that ourselves. And we also need to be mindful of the people we spend time with, finding some people who can say, yeah, that's tough. Not necessarily then talk about it for 3 hours about how tough it is, because that also can be unhelpful for our mental health. It might be sitting with it for 5 minutes going, that's really tough. And what can we do going forward? Allowing the validation to be there. Because it is important that we look at our behaviour, we also look at our actions. What can we be doing to change our situation so that in 1 month, 6 months, 5 years, we're in a different position than we are now? So when we look at behaviour, one of the things I was reflecting on in thinking about tonight was some of the challenges that have come with COVID, but also generally with a health condition. One of the things that can be really important for our mental health is a routine. a regular get-up time, some things that fit into our day that create that structure. I have many clients that say to me, I don't do routines. I don't like structure. I just like to see how I feel. The problem is sometimes when we have health conditions, what ends up deciding what we do is our pain, our fatigue, our symptoms. And so we end up still being controlled, not by what we want to do, but by our health. So looking at where we can put structures and routines in place can be really important. We know with sleep, a couple of things that impact our sleep the most is a regular get-up time, 7 days a week. Helps our sleep rhythm form a healthier pattern and deeper sleep. The other thing that influences our sleep the most is what we call sleep efficiency, the percentage of time that you're in bed that you're sleeping. So developing a routine can be important, and that may need to have changed for you recently. In terms of other behaviour things that we need to do, exercise. Now, again, for you, what that exercise looks like might need to change. For some of you who have been involved in a group exercise, whether it's a Pilates or hydrotherapy or a walk, you might not be able to do that in the same way at the moment. So it's adapting things to the situation. Or you might have a flare-up of symptoms of your condition and you can't do it in the same way that you were doing. Always looking at how can I replace that in something that adds value to my health. Pleasant activities. What do we enjoy? What makes us laugh, makes us smile, makes us feel like we've achieved something? Again, at different times, our expectations around this need to adjust. But I find anyone who goes looking for something can find pleasure in something, even if it's something you've never done before or never thought you'd want to. Relaxation helps. What relaxation is separate to doing a relaxing activity, because we might call watching a movie a relaxing activity. But if we watch a thriller or an action movie, our heart rate's going to go up. Our tension goes up. When we talk about relaxation, it's looking at ways that decreases our body's arousal, that slows our breathing down, that lets go of some of that muscle tension, that helps us lower that arousal is really important from our mental health, from our pain, and how we can manage our health. Often I hear people say, oh, I use distraction. One of the things I think is more helpful to think about is engagement in an activity rather than distraction. We all hear the phrase, don't think about pink elephants. Soon as you try and distract yourself from pink elephants, if I keep saying don't think about pink elephants, don't think about pink elephants, it doesn't tend to work. Whereas if I get you to think really hard about purple rhinoceroses, I want you to picture the purple rhinoceros. As you do that, you don't think about pink elephants as much. That's because you've engaged in something. So it can be more important to engage in smelling the flowers in your garden, noticing the sunshine. If you engage in that, that will mean you're not focused on other things so much. So what's really important with all of this is acknowledging for each of you, you're in a completely different situation. You'll have different health conditions, be at different stages in that journey, it'll be presenting differently. How that impacts on your mental health, whether you feel like at the moment you're in the minuses or you feel like you're in the positives, is going to be different as well. What I encourage each of you to do is to think about what your next step is after tonight from what I've said. For some of you, you might go, hey, pat yourself on the back. You might go, yeah, I'm actually doing a few of those things. Good job. For others of you, it might be, oh, yep, that's helped me in the past. I'd completely forgotten that. I'm going to get back on track. For others, you might go, right, shoulds. Yep, I've realised I have a lot of them. I'm going to see if I can shift that. You might take one thing away that you can implement that becomes part of your toolbox in managing your health. And for others of you, you might go, I'm so overwhelmed, or I'm not even sure where to start. What I'd recommend is then looking at what professional help you can get that can help you build that toolbox of strategies that can be your next step in managing your health. Now, what I'd like to do is to be able to open up for some questions to look at how you can be managing your health condition and your mental health at the same time.
Thanks very much, Jacqui. As always with your webinars, they're so full of information and so practical. You know, I love listening to your presentations because I'm also just thinking about sort of, you know, different messages that you're putting across that are also relevant to my life or everyone's life. So I think it's really worthwhile, very, very practical, which is fantastic. I'd encourage people, if you have any questions, to type them in the question box now. If you could keep your questions to a fairly general nature. If there's anything quite personal that you would like to ask, it probably is not really the forum to do that tonight. You could always contact Jacqui at her practice in a professional sense if you have a question. But if you could keep your questions, if they're very personal, maybe just hold them off for another time. Jacqui, just while we're waiting for some questions to come through, I think people are so intently listening, we haven't got a lot of questions come through yet. But one thing you mentioned, you sort of said when an issue is not necessarily universal and maybe other people don't really sort of check in and ask about it. To what extent, and I like the idea as you're proposing that people sort of in a way develop their own sort of self-resources to manage and deal with different things. To what extent should you sort of reach out or actually share with others, apart from actually relying on your own and developing your own resources? That sort of actually, when people aren't asking, when should you tell?
I think it's a really good question, because I think often we can get really hurt by people close to us not checking in the way that we want, or the frequency, or responding in that way. And we don't necessarily tell someone how or what we need. And sometimes we don't even know ourselves, but somehow we want people around us to know and be able to respond in that way. So I think it's important in ourselves to go, what is it I need and want, or even acknowledge that we don't know. I think it is important to be able to ask family members for that. In a reciprocal way though, acknowledging they've got their life going on, other people around you will have their life. And I think one of the challenges that we can often have around our own health is, I feel like I'm struggling. I don't want to burden someone else because I already know they're going through something. The interesting thing is, as humans, we're actually created to be in community. So we often can actually help each other a little bit at the same time. So I think actually putting your hand up and saying, hey, I'm struggling, I need this, is really powerful, particularly if something's gone on for a period of time. So it might be you've lost someone who's passed away. People often check in for a week, a month. It might be at 8 months later, 3 years later, saying, hey, just want to let you know, I'm having a really tough time at the moment. Because you also don't want someone asking you every day how you're going about that for 20 years either. If you feel like you're not getting the support that you need despite that, that's when I think professionals can be really useful in that space as well. Because it means, I have clients say to me, I love coming to see you because I can just put it on you and it's your job to be able to handle it. And particularly for people who struggle to reach out, it can be really powerful to go, this is my space where I'm not responsible. I don't need to check in. I don't need to look after someone else. Here's someone that's their whole role for this next 50 minutes is to help me. So if you keep getting hurt by family and friends not helping you in the way you want, I'd actually encourage you to seek professional help to help you help yourself, but also provide that professional space as well.
There's a question, Jacqui, about how would you try to shift the fear of pain, especially pain during movement, exercise, physical activity? So basically that's shifting that fear.
Which is a great, because I think that comes to two things. One is the fear, how it develops, and fair enough, because pain is really, really, really unpleasant. And so people often try and do positive thinking. Let me try and be more positive about it. I'm sorry, pain is unpleasant. You're not meant to like it or want it. What we often do in our pain clinic is we really focus on amounts of a movement that are more manageable, because often with chronic health conditions you get so used to pushing hard into that pain, which often can keep you stuck. So sometimes it's about doing an amount that may seem so little initially, but you want to make it less intense pain so you have less pain to be scared of. Interestingly, when we know we're going into a movement that causes pain, what we tend to do is brace ourselves and hold our breath. And our brain's going, oh no, oh no, oh no, oh no. So what we want to do is, you think through the triangle, we want to target all three. We want our thoughts to go, I can get through this, this pain will pass. So the thoughts are helpful, not I love this pain, helpful. Emotions, I am concerned and that's okay. And behavior, relaxing those muscles, breathing through the movement. What often happens is you have less pain. because you're not adding that stress response, that tighten response that adds to the pain that you're going to have anyway with that movement.
Mm. And actually, someone who's a physiotherapist is just asking about how might that person help their clients in relation to strategies when clients are in that pre-contemplative stage of change or in a denial about the best way to get help.
And I think that is a challenge as a health professional. I think for all of us, we become health professionals because we want to help people and we see where we want to get them. So I run training for health professionals, and one of the things we talk about that is when we were, you know, I'm so enthusiastic. I warn my clients all the time, tell me if I'm going too fast, because I see so much hope and potential that I want to jump to here. What's really important as a health professional is to go to where the client's at. If someone's in the pre-contemplation, it generally means they don't have enough information yet to know there's another way. It may be that they feel like they've failed. I've got a client at the moment, she goes, every treatment has failed me. I don't even know if I want to try again because I'm so scared to be disappointed again. So listening and asking questions and finding out why they're stuck in that pre-contemplation phase. It might be information. It might be they're overwhelmed and they just need to know the next 2 steps. Some clients I find are happy to go, you know what, I don't believe it's going to work. I'm not even sure, but sure, I'll try it for 4 weeks. So it depends on the personality of the client, where they're coming from, but really, 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 really important as a health professional, be more curious, slow down, ask more questions so you can meet your client where they're at rather than trying to get them to come to where you want them to be. It's the quickest way to help people.
Someone is just querying about when smoking is a primary way of pain management.
And it's interesting, isn't it? I think all the time, this comes back to the choice and consequences. There can be 2 sides to the consequences. So if your way of coping with the pain or coping with anything works for you, keep doing it. The problem is with something like smoking, if you go, hang on a second, there's health risks with that as well. Yes, it's fixing one problem, but it may be creating another. That becomes the juggle and weighing it up. And so it's looking at what is it about smoking that helps you manage the pain? Is it that it's something pleasurable for you? Is it that you're doing deep breathing while you're smoking? Is it that you're outside in the garden while you're smoking and you actually like being outdoors? So is there another way that you can meet some of those needs that add more health benefits than accidentally creating another problem? That's the same with anything, whether we use smoking, alcohol, binge watching Netflix, all of those things. If it's actually distracting and causing another problem, doesn't really work in the long term.
And Jackie, what about with regards to a person with fibromyalgia who is suffering lots of physical symptoms and generally unable to sleep well and therefore sort of recover or manage their condition well?
Pain and fibromyalgia, has the pain, the fatigue, the mental fog, a whole lot of things. And I think for a lot of conditions, those symptoms are there and it impacts on our sleep. The challenge that we have is when we have more pain, it makes it harder to sleep. But when we don't sleep, it makes our pain worse the next day. So interestingly, the research shows that actually improving your sleep has the biggest impact on your pain rather than trying to improve your pain for your sleep. So the take home from that is make sure you're looking at what you can do to manage your pain and specifically get treatment or support around your sleep. Even when you've got pain, there's a whole lot of things that can be done. What we often do though with sleep is, and even health professionals will often tinker with sleep, they'll change 1 or 2 things to hope the sleep gets better. What I find way more effective is when I work with clients with sleep difficulties, I get them to decide, are they 2 feet in to making that change now? Because it's hard. It's a 4-week plan with a whole lot of changes to establish a really good sleep pattern. Now, that may not be a perfect sleep pattern, but I've found every person that follows through improves their sleep significantly. What that then means is you have less pain, and I don't know about you, when I don't sleep well, I'm emotional the next day. So it improves our mental health, which helps us get out and go for that walk, which helps, and the snowball starts turning in the direction we want rather than feeling like everything's getting more overwhelmed. So I think for any of you that have sleep problems, seeing someone who actually can target that can be really helpful. I find generally if I work with someone on sleep, purely if that was it, it'd be 1 session of education and getting people to do a sleep diary, a session for their strategies of what they're going to do, and a review. It often doesn't take a lot if you've got some really good education around what we need to do to improve our sleep.
And Jackie, there's a question, what are your thoughts on ACT? Now, I'm not sure what that actually stands for.
I'm assuming ACT is actually ACT, Acceptance and Commitment Therapy.
Right.
So if I could spend 2 days talking to you all about this, I could probably fill 2 days about it. ACT is wonderful. So acceptance and commitment therapy is about accepting where you're at. And if you think about the wishful thinking word I used, I talk about acceptance. But it's also about commitment to action that moves you in a way that's important, that's value-based in your life, that's realistic. So my approach, I use a lot of cognitive behaviour therapy and ACT. My philosophy is change what you can with CBT and then accept what you can't with ACT, and between the two of them. Now, sometimes different people resonate with one more than the other. I think both have a lot of value. So for any of you who are seeking professional help in this space, cognitive behaviour therapy and ACT, acceptance and commitment therapy, both have a lot of evidence supporting their use from a pain perspective and also from a mental health perspective.
And actually, just sort of on that same note, someone's asking about asking just to sort of elaborate a bit more about wishful thinking and how to actually come to acceptance. So
it's a really good question, because all of the things that I talk about I find really hard, because I can make them sound so simple, but doing them in the real life, way harder. So wishful thinking is to acknowledge the hopes and the wishes and desires, and acknowledging where you're at. That gap needs the grief to go, I'm not there now. So acceptance, sometimes what people can do is, the first thing they can start doing is, I'm working on accepting I'm where I'm at now. Because to say I accept it doesn't feel true enough. And acknowledging that acceptance is just going, it's where it is right now, and is a really important word as well, and I'm going to keep trying to change it, not but. What but does is it negates it. And often when we start looking at acceptance, we accidentally we undo our acceptance by using the word but. So it's being able to sit there and go, I wish I was independent, I wish I could do my gardening, I wish I was pain-free. And I accept at the moment I can't do my gardening without flaring up. I accept that I have pain, I don't like it, I accept it's there. And I'm going to focus on what I can do to move forward. Sometimes that is the mental exercise of repeating that. I sometimes have people having it written down. If you're doing anything to change your thinking, it's really powerful to say it out loud. Because when we say it out loud, we need to think it, we speak it, we hear it. And more importantly, we notice the tone. Because if I sit there and go, I accept that I've got pain, we're not going to believe it. Our tone matters. We need to go, you know what, I accept that I've got pain. We need it. So when we say it out loud, it's actually a lot more effective in helping us in that acceptance process.
Someone's said that they don't set goals, hopes, or dreams for themselves. They're not wanting to accept this, but they're struggling with the clarity of what realistic maybe goals are with chronic pain, the ability to start setting them. And they just comment that they feel like they've had their head in the sand for too long.
And I think it's also being kind to yourself around that. But I think sometimes it's okay to put our head in the sand for a bit and just go, ugh, I need a break. Particularly with chronic health conditions, you're in for the long haul. It's a marathon. I think sometimes for many of you, it's an ultra marathon. And so you're not going to have the same flow, energy, drive, hope through the journey. It's going to fluctuate, and that's okay. So if you need to bury your head in the sand, or other people say to me, I'm having a pity party about it at the moment, that's okay for a period of time. But it sounds like you're acknowledging that it's gone on a bit too long. I think what's important around goals, and this is an area I'm really passionate about in the pain area. So I could talk about pain all day long, because I think the challenge is we either set such unrealistic goals with no support or plan of how we're going to get there, we're only going to be disappointed. Or we set such small goals that even if we achieve it, we don't even really care because it's so meaningless. When we set goals, it's really important that it's looking at all the factors. So for me, whenever I set goals, I set them with a physiotherapist in the same room as me at the same time as a psychologist. I have no idea someone with rheumatoid arthritis, with fibromyalgia, who's currently able to walk 5 minutes. Are they going to get to half an hour? I don't know physically. I need physical expertise around that. What I can look at though is going, you know what, this person is really depressed and struggling. So at the moment, getting them actually doing anything is going to be a challenge. Let's not set it too high, even if physically they're capable, because we need to factor in the mental health with that goal as well. Goals I find most helpful over about a 6-week period. So when you're getting active treatment, where you're actually going, it needs to be short enough that we can see it. So, and therefore realistic in that time frame. Because if we plan a goal for next year, I'm not going to start working on it now. It's too hard to get that action in place. 6 weeks, we find, keeps us focused as clinicians as well, not to get distracted over here or over here. If you want to get back to gardening and weeding and getting down on the ground, we need to make sure all our intervention is helping that. It's important with goals that they're ambitious and meaningful. And so I think it's really important to always look at all domains of your life, your personal, domestic stuff, your social and leisure, and your work or vocation in that way. Because when we think about quality of life, when we think about wanting our old life back again, it's all domains that actually make up quality of life. It's not one of them. Interestingly, when you're working on achieving one goal, the success of one actually makes it easier to achieve the others. At times we work with people who say, oh, I don't want to work on that one goal, I just want these two. They never do as well, I don't find, as when you look at someone as a whole person, their whole life, and look at what are appropriate goals in that space. So I think to work out what's a realistic goal, you need a range of health professionals as well as yourself with you at the driver's seat to help work out what that looks like.
Talking about different goals, someone sort of talking about having a very stressful day at work and then adding the extra stress of fitting in some exercise or losing some sleep. So is there extra stress worth the benefit from completing the exercise? Is the risk of injury increased being stressed out exercising, or would rest be better? Lots of decision making.
Great question. And then all of that thinking going on while you're trying to do it and working it out as well. And this is where I think any plan that you set up needs to be realistic most of the time in your current circumstances. So if you're in a situation where you're working long days and you're exhausted, maybe look at how you can incorporate your walk in getting to and from work, parking further away, so you're not relying on then coming home, making that decision to go out for the walk, adding another task that adds that burden. Looking at how you can make it realistic is, and not all the time, because we're not robots, 80%. What's a realistic plan and problem solving around that to make it as easy as you can? The second thing I'm hearing in that question is that exercise almost feels like a should or a have to. I'm not hearing ownership of that. I'm not hearing I'm choosing to go for a walk, I would like to go for a walk. It's feeling a bit already that stress or overwhelm just from the wording, just sounds like a bit of that's there. So at that moment, being able to change it to, I would like to go for a walk now. You might then go, actually, no, I wouldn't. I really need a good night's sleep tonight. The challenge is, it's not about the one day though, it's the pattern overall. If you choose not to walk tonight because you're going to get a good night's sleep, awesome. But if you choose that most nights and you've got this goal around walking, unless you actually go for a walk, you're not going to achieve your goal. So making sure we don't delude ourselves in how often we change the plan. So make the plan realistic as you can with some flexibility. But if all of a sudden you're never walking with your reason being you're tired, that plan was not realistic and it needs to be changed.
And also, Jackie, someone's asking, how do you change the but to an and when the fear of failure is so overwhelming?
I would say the first thing is sit with that fear of failure and validate that and acknowledge it. If that is overwhelming, it tells me that emotion cup of that is really, really big. And it might actually be sitting with it, potentially crying, expressing it in some way of what those fears are, what those concerns are. Unless that feels heard and released in some way, that other voice, the voices, the arguments we have in our head, stay strong. That tells me that fear and overwhelm doesn't feel heard yet enough to change the and. You can practically just change the word and it can work to some degree. If you don't believe it enough though, the other voice jumps in with, yeah, right, don't believe you. If that's happening, it tells you the word change hasn't worked. So my guess is processing some of those emotions more is going to be helpful.
And I think I got this question right. Is it realistic to think about working when you haven't in quite a long time? I'm not quite sure if the person's actually going to be recommencing work, but they obviously haven't worked for quite some time.
I personally think it is. I'm an incredibly optimistic and hopeful person. Obviously, for any of us not working for a long period of time, for whatever reason, it can be harder to get back into the workforce and be able to work. Depends what you mean by a long time. I've helped people get back to work, haven't worked for 12 years, and they've got paid employment and gone to full-time again with chronic health conditions. So, yeah, definitely possible. We know the longer someone's out of work, the harder it is to get back into work for a range of reasons. But doesn't mean it's not possible. It just means there's more things that need to be addressed. If it's many years that you haven't been working, often what can be good as a stepping stone is look at some retraining. One, to give you the confidence, hey, I can participate in something, I can function, I can follow through on this structure or routine. But it also means on your CV, you've got some recent experience that you're going into any job interview or application with something. So yes, it can be how you manage your pain. Yes, it can be how you manage your communication and your mood, but it's also how you manage your CV to give yourself the best opportunity. So there's lots of factors, but I think it's definitely possible, and I highly recommend it. Work is good for our mental health and physical health. We know that people who are working and engaged in meaningful vocation are a lot healthier. It's challenging, it's not easy, but it's really, really good for us.
So we've only got a couple of minutes to go, and Jacqui, we talked a little bit tonight about, sort of times you might sort of seek professional help. I know sometimes there can be, a cost involved in that some people are unable to afford. So a GP management plan or a GP mental health plan can give people sessions with a mental health psychologist. That's correct if people don't have the resources to see psychologists independently?
Yeah, it depends on the psychologist. So only a small number of psychologists bulk bill where there's no out-of-pocket expense with a mental health care plan. So generally there will be an out-of-pocket expense, and that will vary depending on the practitioner. The mental health care plan often gives you a higher rebate than the enhanced primary care plan, the EPC. And also the mental health care plan gives you up to 10 sessions in the calendar year. The EPC is 5 sessions, but that's shared between physiopsychologists. So mental health care plan is often the better way to go. And then I think in terms of accessing treatment, it's asking those questions up front. Interestingly though, I would say sometimes if people come to me and say they're struggling to afford the gap, we might even say, hey, how about you save up little bits for a bit so you can get a block? Because you want some consistency in treatment. Once a month for a check-in won't generally help you achieve your goals. So it might be problem solving around what can make it easier for you to be able to access it at the moment.
Look, we're very close to 8 p.m. Eastern Standard Time. Jacqui, I'd like to thank you again for a very generous presentation. You're always generous with doing webinars on behalf of Musculoskeletal Australia, but also just the information you provide and the way you provide it is always an absolute delight to view. So thank you so much for tonight. I'd like to thank AbbVie Proprietary Limited once again for their sponsorship of the webinar this evening. Can I remind everyone to take a moment at the end of the webinar now? There'll be some questions that will come on the screen, which are always very handy for us to get your feedback. So, and I also ask you to remember our next webinar, which will be towards the end of June. Again, that will be on the topic of polymyalgia rheumatica. And so if you're not registered for that, I suggest you do so. So on that note, I would like to thank you again, Jacqui. Thank you to AbbVie, and thanks to everyone for joining us this evening, and wish everyone a very good night.